And today I'm going to talk to you about prediabetes. We're going to talk about what diabetes is and what prediabetes is. We're going to talk about the testing criteria for prediabetes, the causes, the importance of weight management in the prevention of prediabetes and diabetes, and then finally we'll talk about other lifestyle interventions for people with prediabetes, including diet and exercise. First, we'll talk about what is diabetes. Diabetes is a chronic disease associated with abnormally high levels of glucose or sugar in the blood. There are two different types of diabetes. Type 1 diabetes used to be called juvenile onset diabetes because it often begins in childhood. It's an autoimmune disease where the beta cells of the pancreas that produce insulin are destroyed by the body's own immune system. It happens very quickly and is most often found in children between 8 and 12 years of age. It runs in families, and so people with type 1 diabetes do not make any insulin in the pancreas, so they have to inject insulin in the body. Under normal body conditions, we consume carbohydrates and the sugars in our food are broken down and enter the bloodstream. The glucose or sugar in our blood is needed for our body cells to get energy from. The pancreas secretes insulin in order to allow the sugar to enter the body cells. Without insulin, the glucose is not able to go into the body cells, and the amount of glucose in the blood increases to levels that we start to see negative side effects. Type 2 diabetes is a little bit different. It develops over a long period of time. The pancreas still works correctly and is producing insulin, but the problem with type 2 diabetes is that the cells no longer respond to the insulin. This is called insulin resistance. This is the most common type of diabetes. It accounts for about 90% of diabetes cases in the United States. It's caused by family history, obesity, limited physical activity, and a poor diet. In this slide, we can see the location of the pancreas, which is the shaded organ located behind the stomach. Now, what is prediabetes? Prediabetes is diagnosed when glucose levels in the blood are abnormally high, but not high enough to be considered type 2 diabetes. If you have prediabetes, slightly elevated blood glucose levels, and you do not change your diet, your lifestyle, exercise behaviors, you're likely to develop type 2 diabetes within a 5 to 10 year period. There are a lot of signs of untreated diabetes. People who have high blood sugars have increased thirst and increased hunger, along with frequent urination. These symptoms are the body's way of dealing with the high amount of glucose in the blood and trying to get rid of it. Other symptoms might include fatigue and weight loss. These are related to the fact that the cells are not getting enough energy from glucose. Over a long period of time, symptoms of high blood glucose include blurred vision, an increased risk of infection, and delayed wound healing. These are often related to a condition called diabetic neuropathy, where those high blood sugars over a long period of time damage the nerves in the body. Prediabetes, that slightly elevated glucose level, does not exhibit these symptoms. The glucose levels are elevated, but not high enough for any negative symptoms to really manifest. So sometimes with prediabetes, you might experience some of these symptoms in a milder form, or you may not have any symptoms at all. Really, the only way to know whether you have prediabetes is to get tested. There are 3 different tests that we can use to diagnose diabetes or prediabetes. The type that's most commonly used in health risk assessments through CoxHealth Wellness is the fasting plasma glucose, or FPG, or sometimes it's called fasting blood glucose. This checks your glucose levels in your blood when you haven't eaten anything for 10 hours, so you're fasting. Diabetes is diagnosed if your fasting plasma glucose is 126 milligrams per deciliter or greater than that. Normal is less than 100, and so prediabetes is going to be 100 to 125 milligrams per deciliter. Another test that's sometimes used is called the hemoglobin A1C. This test measures the average blood glucose in your body over a 2 to 3 month period. Diabetes is diagnosed when we see an A1C of 6.5% or greater, with prediabetes between 5.7 and 6.4%. If you see your physician to be tested for diabetes, you might undergo an oral glucose tolerance test. This is a test where you drink glucose, sweet, syrupy liquid, and you have your blood glucose tested after you drink that. Diabetes then can be diagnosed from that oral glucose tolerance test. In the United States, 25.8 million people have diabetes and another 79 million people have prediabetes. Together, these two groups make up a third of our population, and it's estimated that about $245 billion is the cost of diabetes in the United States, including direct medical cost, reduced productivity due to the disease. Diabetes contributes to a total of 231,000 deaths per year, and the incidence has tripled since 1980 and shows no sign of slowing down. As we've seen obesity rates increase, the incidence of diabetes has increased along with that. And so diabetes is a very costly disease to treat. It places a very high financial burden on the patient as well as the healthcare system, because if it's poorly managed or untreated, it can cause side effects like blindness, the loss of kidney function. In fact, kidney disease is the #1 side effect of diabetes, and amputations. It's also a major cause of heart disease and stroke. So we really want to deal with prediabetes very quickly through lifestyle changes in order to reverse the course. If you have prediabetes, you can start changing your diet and your exercise habits and reverse the course of developing diabetes and decrease your chances of getting it. There are several factors that cause prediabetes and diabetes. I mentioned that there's a genetic link, so family history is an important risk factor, but this is a risk factor that we really can't change. If you have a history of type 2 diabetes in your family, it's even more important for you to focus on the other risk factors that we do have control of, such as obesity, inactivity, and poor diet. One of the things that we can look at as far as risk for diabetes or prediabetes is body mass index, or BMI. Body mass index is an indirect way of assessing health risk based on your height and weight. And so this table can indicate your BMI if you look at your weight along the bottom row of numbers and then cross-reference that with your height along the other axis, and you can see what area your BMI falls in. If you're within a healthy weight, your risk of prediabetes or diabetes isn't increased due to weight status, but in the overweight or obese category, it is. Now we're going to transition into lifestyle interventions for people with prediabetes. You can engage in order to decrease your risk of developing the disease later on. A landmark study by researchers at George Washington University looked at 1,079 people and compared the subjects that underwent an intensive lifestyle intervention against subjects who did not. And they found that a weight loss of about 7% of your body weight and physical activity that averaged about 20 minutes a day reduced the risk of converting prediabetes to diabetes by 58%. The subjects also experienced a reduced risk for cardiovascular disease. And so weight loss is incredibly important. Somewhere between 7 to 10% is thought to significantly improve insulin resistance. And so that's a good initial goal. If you're overweight or obese, think about losing 10% of your body weight in order to experience greater glucose control. Now, this is going to occur over a period of 4 to 6 months. So we're not talking about a really rapid, drastic weight loss. Slow and steady is what we're looking for. This is easier to maintain than a very rapid, quick weight loss from a crash diet. And our goal is to experience changes in our diet and lifestyle behaviors that can be maintained for a long time after the weight is lost. That way we can avoid the yo-yo dieting that so many people experience that really can cause major issues with our metabolic processes. Physical activity is also beneficial for treatment of diabetes and prediabetes. It helps us to lose weight or maintain a healthy weight. It drastically improves blood glucose utilization. After exercise, our cells become much more receptive to insulin because we're trying to feed and fuel those cells that we used energy up during the exercise bout. And so exercise promotes good blood glucose control. The exercise you want to look for is of moderate intensity, where your heart rate gets up, but at a level where you can still talk and carry on a conversation. It should occur in bouts of about 20 to 30 minutes per day on most days of the week, and the goal is to get about 150 minutes of exercise total. If you work out at a more intense level, you can do a little bit less, about 90 minutes per week. And so this might be sprinting or circuit training, running up and down stairs or hills, really anything at a faster pace to get your heart rate up a little bit more. Strength training is also important to an exercise program. Muscle mass is more metabolically active than fat, so if you incorporate strength training, you will lose fat and build muscle. Your overall metabolic rate will be higher, and so we want to aim for strength training 2 to 3 times a week. Now you know what prediabetes is and how it can damage your body. You know that you need to lose weight in order to adjust those lifestyle risk factors, but you might be wondering, what is the best diet or eating pattern to follow for prediabetes? The information that's out there can be very confusing and conflicting. In the media or in popular diet books, we see instructions to stop eating sugar or stop eating carbs. You might wonder if you need to eat low glycemic index foods only, or maybe a low-fat diet is the best way for people to lose weight. Many people think that their number one priority when eating for prediabetes or diabetes is to no longer eat any sugary, sweet foods at all. And for most people, diabetes and sugar is very closely linked. But in reality, that's not the priority for people with prediabetes. People with type 2 and type 1 diabetes have to pay very, very close attention to the amount of carbohydrates that they're eating. They have to count the carbohydrates to make sure that they're injecting enough insulin or taking medications in order to handle that carbohydrate. They may have to check their blood sugars frequently before and after meals and coordinate the amount of carbohydrates that they're consuming. For prediabetes, carbohydrate counting is not needed. We need instead to focus on the right types of carbohydrate-containing foods, weight loss, and activity. So we really want to eat a generally healthy, well-balanced diet that includes foods from the different food groups, including foods that have some carbohydrate in them. We want the diet to be reduced in calories enough to allow for 1 to 2 pounds of weight loss a week if we need to lose weight. And we want to develop skills and changes in our behaviors that will help us keep the weight off for good. One great tip is to start writing your food down. It doesn't matter what you use. You can use a notebook, you can use a special food journal or food log, you can use an app on your phone or whatever. But writing your food down is one of the most important parts of changing your eating behaviors. The type of diet does not matter as much as is it a diet that you can stick with. We want to avoid the yo-yo dieting phenomenon. We want to have a healthy relationship with food, be mindful while we're eating, and so on. One of the ways that I talk to patients about eating for prediabetes is to use the plate method. And this is a picture of the CoxHealth Healthy Plate that was developed by our dietitians in order to teach clients about healthy eating. It shows the different types of foods and the amounts of those foods that you should be eating on the typical plate for weight control, for prediabetes, and also for general health. So it can help you figure out exactly what you should be putting on your plate and in what proportion. One thing to note is that the plate size in this photograph is about 10 inches. And so plate sizes today are often much larger than a 10-inch plate. When we eat on bigger plates, we tend to eat more food than people who eat on smaller plates. And so it's a good place to start to kind of evaluate the size of plates that you have and keep that in mind that we're looking at a 10-inch plate when we are comparing against the Cox plate. When you fill your plate, fill it half of it with non-starchy vegetables. These are low energy dense foods. That means for a larger volume of food, or the size of the food, there are fewer calories. There's some research that indicates that the larger volume of food helps us to feel more full, like we've eaten more. And larger volumes of foods with lower calories have more water, which fills our stomach. Vegetables and non-starchy vegetables and fruits as well are also nutrient-dense food. And so this is a food that's low in calories, but very high in nutrients like vitamins, minerals, and fibers, nutrients that our body really needs more of. And they're high in phytochemicals, which are substances in plant foods that protect our body from disease. The other half of the plate is divided between a carbohydrate source or a starch. So this could be whole grains like oats, barley, quinoa, rice, or it could be starchy vegetables like potatoes or sweet potatoes, winter squash like acorn or butternut squash, or beans. And then the other fourth of the plate is made up of a protein source, meats, fish, eggs, cheese, or other protein substitutes like soy products. Fruits, dairy, and fats also can make up a healthy plate, although they don't have a major role in the plate. They can be an accompaniment to a healthy meal. And those foods, fruits and dairy, are going to contain carbohydrates, but more nutritious sources of carbohydrates. So the main idea with eating for prediabetes is that we can eat carbohydrates, but be sure that they're the right types of carbohydrates. In this slide, in the left-hand column, we have foods that are not going to contain significant amounts of carbohydrates, so they won't affect your blood sugar. But then on the right-hand column, we have foods that do have carbohydrates that can affect your blood sugar. But these are the types of carbohydrates we want to be eating on a diet for weight management for prediabetes. Fruit, unsweetened dairy, tubers like potatoes and winter squash, whole grains, and beans. In this next slide, we have other types of carbohydrate containing foods that are very, very highly processed, highly refined, and high in carbohydrate. And this is a recipe for disaster. These types of foods are broken down into blood sugar very, very quickly and will provide a very rapid insulin response in order to take care of those sugars. So these sources that are less nutritious carbohydrate sources include white flour and any products made with white flour, white rice, refined snacks and sweets, cakes, cookies, pies, etc., refined breakfast cereals with added sugar, juice, soda, fruit drinks, and lemonades or other type of aids, dairy desserts with added sugar like pudding, or even sweetened yogurt or ice cream, smoothies, and milkshakes. Those you want to avoid. It's not that a person with prediabetes can never consume these foods, but you definitely want to consume them less often and be sure you're getting your carbohydrates from those more nutritious sources I mentioned earlier. Since prediabetes is characterized by impaired insulin sensitivity, it seems intuitive that controlling dietary carbohydrates, the main nutrient that affects blood sugar levels, is a logical dietary approach to treat prediabetes. And so sometimes a lower carbohydrate, or more commonly a moderate carbohydrate approach, is recommended, especially for people who need to lose weight. And a low carbohydrate or a moderate carbohydrate diet can be very effective when people are trying to lose weight. One thing that it does is typically if you lower the carbohydrates, you're going to be increasing either the fat or the protein. And fat or protein are more satiating. They provide a feeling of fullness. So they can be easier for people to stick with when they're trying to eat a restricted calorie weight loss type of diet. In addition, the dietary reference intakes recommend that we consume a minimum of about 130 grams of carbohydrate a day, and the average American woman consumes closer to 200, and the average man consumes 300. So we're really over-consuming carbohydrates, and it's not from starchy vegetables and whole grains. It's those refined, high-sugar carbohydrates that I mentioned on the earlier slide. So the next couple slides have some examples of how you could focus on the amount of refined carbohydrate in your diet and kind of dial that down, replace it with a better protein or healthy fat source to provide a sense of fullness and provide better nutritional balance. So on this slide we have a typical breakfast on the left that includes breakfast cereal with milk, a banana, and a glass of orange juice. And that's going to get you about 72 grams of carbohydrate with moderate portions. And then on the right-hand picture, we have another breakfast where we have unsweetened yogurt with berries and some hard-boiled eggs. And this is going to get us 25 grams of carbohydrate, so significantly less. On the next slide, we have maybe a typical lunch that you might get at a cafe or a restaurant. So on the left, we have a chicken salad sandwich on a croissant with a cookie and a bag of chips, and that's going to get us about 54 grams of carbohydrate. Keep in mind the DRI says 130 grams a day, so that's pretty significant for one meal. And if you had a soda with that, you'd go even through the roof, because a 20-ounce Coke has 65 grams of carbs, so you'd more than double that. And then on the right-hand column, we have the same chicken salad sandwich on a croissant. We've eliminated the cookie and the chips and replaced it with the salad, and that gets us down to 22 grams of carbohydrate. In the last picture, I have a tater tot casserole with a glass of milk, and that gets us about 50 grams of carbohydrate versus a portion of meat. It could be steak or chicken or pork, along with some roasted vegetables and a side of, in this picture it's toast, but we also could have a small baked potato or mashed potato, and that gets us about 15 grams of carbohydrate versus the 50 in the casserole. So paying attention to those foods that contain carbohydrates and trying to minimize the portions, or at least choosing the healthier types of carbohydrates, are going to improve the overall makeup of the diet. On this last slide, I have some snack ideas. And so snacks are often a place where people tend to go toward more processed, refined carbohydrate types of foods. And so these snack ideas are going to get you away from that and get more toward whole foods that don't have as high of a carbohydrate content. Healthy snacks are going to include nuts, soy nuts, yogurt with berries. I've got some vegetables with hummus on there, natural peanut butter, hard-boiled eggs, cheese and fruit, and even some dark chocolate, which has a lower sugar content, and the slightly bitter flavor often helps people consume a little bit less. So in closing, prediabetes is a condition that affects many Americans. It's very serious. The likelihood of developing diabetes down the road is very high with this condition. But with changing your lifestyle, focusing on eating a healthful, balanced diet, including exercise and physical activity into your daily routine, along with weight management, can totally reverse the course of developing diabetes. I hope that you were able to learn some information from this presentation today.